Welcome to the Patient Advocacy Show. My name is Kyle Chung, along with our Patient Advocacy Club members and research team at Touro University California. Disclosure: the views shown in this presentation may not necessarily represent the views of Touro University. In this episode, we'll discuss how do I represent my experience with a chronic condition in my health record. The purpose of this community outreach video is to improve patient-provider communication in the clinical setting. In particular, we want information in health records to be accurate so patients are heard and understood, and also meaningful so medical providers can discover an accurate diagnosis and effective treatment plan for each person. In the description of this YouTube video, we include an IRB-approved survey. I invite you to watch this video and then click on the link. We would like to know how you feel about these new policy changes with your answers and comments in the survey. Our topic today is, how do I represent my experience with a chronic condition in my health record? Let me start with 1. Why should a person represent their experience with a chronic condition? In other words, why should a person want to do this? And what's wrong or missing with the current system? 2. In regards to representing your experiences in your health record, what are the benefits of doing this? And how could someone do this if they wanted to?
Health record documentation guidelines, which have been used as a federal standard since 1995, have resulted in a high amount of inaccuracies and missing information. As a result, there's a high chance that what is written about you in your health record may not tell the whole story. You have a chronic disease, such as diabetes. Your experience, home sugar readings, your tolerance and adherence to medication, and how you manage to take care of yourself tell a story. New 2021 federal documentation guidelines encourage the patient to contribute information that can be accepted into your health record.
If this information is accepted into the health record, who is to say it is ever read?
The medical interview, known as the history, was one of the 3 components for health record documentation according to 1995 and 1997 documentation guidelines. Doctors were paid according to how many questions they asked and how many the patient answered. Starting January 1st, 2021, in the outpatient office setting, documentation of the history is no longer part of the physician payment formula. Starting 2021, documentation of the history is dependent upon what the provider feels is medically appropriate. New rules specify that patients themselves can answer the history questions and have their own words populate the history in health records.
So a patient has the federal right to answer the history questions and submit their answers with the intent of co-authoring the health record and telling their story?
Yes, exactly. Individuals in the United States have had the federal right to request to amend their health record since the HIPAA privacy rule of 2001. In addition, final rule in the 2018 Federal Register for the calendar year 2019 made it clear that patients are permitted to author the history portion of their health record. Now for 2021, the CPT manual recognizes the patient-completed history questionnaire as being a history source for documentation.
So new 2021 health record policies reaffirm a 2001 federal law and a 2018 administrative law. How can someone tell their medical story about a chronic illness?
An easy way is to review all of the history questions yourself. You can pause this video and go to www.patientadvocacyinitiatives.org. On the left column, you will see 3, Page Universal Prehistory Form. Click on it to get your own copy. You can print it out if you like and then resume watching this community outreach message. This prehistory is a replica of the history from 1995 and 1997 documentation guidelines. Overall, it's about 30 questions. This prehistory was also used in published clinical research where patients were encouraged to tell their story and author their own health record during a visit with their family doctor.
Okay, great. Let's say everyone had a chance to get their own prehistory form, or they'll do it later. What do they do next?
Locate the area on the form called Chief Complaint. This is the reason for your medical appointment. In here, to address a chronic disease or condition, you'll write chronic care for whatever the condition is. A person with chronic back pain will write care for chronic back pain. A person with diabetes and hypertension might write chronic care for diabetes and hypertension.
Before we move on to the next questions on the prehistory, what is a chronic condition?
A chronic condition or chronic disease is a problem that is expected to persist for at least 1 year and/or for as long as the person is alive. Diabetes mellitus and hypertension are good examples of chronic conditions.
As we get back to the prehistory, what happens if the person has more than one chronic condition? Or what if they have a chronic condition and a new problem? Do they complete separate prehistory forms?
No, we recommend completing only one prehistory form to capture the entire story for each medical encounter you attend. As we go through the prehistory, you will see how the 1995-1997 format gives the opportunity to represent multiple problems.
Okay, one prehistory form to tell the story. Tell me how someone would represent themselves if they had diabetes and a new problem. Let's say numbness of the feet.
In the chief complaint area, the person would write foot numbness and chronic care for diabetes. The next section is the history of present illness, or HPI. The HPI is the journalist equivalent of who, what, where, when, why, and how. Specifically, the HPI asks for location. Where on your body is the problem? Quality. What does the problem look or feel like? Severity. How bad, for example, is the problem on a scale of 0 to 10? Duration. How long have you had the problem? Timing. When does the problem occur? Context. Did any circumstances cause this to happen? Modifying factors. What makes the problem better or worse? And associated signs and symptoms for additional comments. This patient with foot numbness and diabetes could answer these questions with this statement. Both feet feel numb, 4 on a scale of 0 to 10 for the past 3 months. Bothersome when I try to rest at night or in the afternoon. No injuries or falls. Better when I'm distracted. Worse when I pay attention to my feet. I am having difficulty walking, especially in low light, because I cannot feel the floor when walking.
How would this person represent their diabetes in the history of present illness?
The person should answer with the history of present illness subset, status of chronic condition. Status was added to documentation guidelines in 1997 to better capture the patient's experience with a chronic condition. Rather than ask duration, or how long have you had diabetes at every medical encounter, status looks for an update of what it is like for the person to live with a chronic condition. Of interest, in 2013, the Centers for Medicare and Medicaid Services, or CMS, officially included status into both 1995 and 1997 documentation guidelines.
Thank you. Give me an example of what the person's status of chronic condition could look like in regard to diabetes.
Status for diabetes could look like this. Diabetes mellitus. My fasting blood sugars run from around 115 to 120. I take metformin 3 times a day and experience no side effects. Last visit, we increased the dose from twice a day to 3 times a day. You warned me that I could experience some diarrhea or abdominal discomfort. Fortunately, I've not experienced either. I'm watching my diet, particularly with snacks after dinner. I'm eating Fuji apples. I take a walk daily at the park for 45 minutes. I suspect that the foot numbness could be related to my diabetes.
That tells a lot of meaningful information. Could the person write more if they need to or want to?
Sure. I imagine the person writing what was mentioned and also adding the following. At our last visit, my hemoglobin A1C was 8.2. We raised the medication dose with the hopes of lowering the A1C and avoiding progression of the condition, such as neuropathy.
That additional information requires a person who really understands their condition. How likely is it that a person with diabetes knows their hemoglobin A1C level?
It is a common misperception to assume that patients do not understand their condition. When it comes to the experience that the person has with the condition, we should be aware that they are the best person to explain what it is like to live with that condition. As far as a person with diabetes knowing their A1C level, it also depends on their medical provider. The word doctor actually means teacher. If the person has diabetes for only a month or 2, then it is understandable that they might not know their latest hemoglobin A1C levels. If, however, they are expected to have diabetes, perhaps for as long as they live, then it is good to teach from the medical provider's perspective for the patient with diabetes to be aware of important metrics, such as the hemoglobin A1C level, because the value is critical to achieving the condition control in order to prevent progression and complications of the condition.
Understood, thank you. It is important for medical providers to see themselves as teachers to better empower patients to battle their condition. Okay, we have completed the history of present illness. What is next on the prehistory form?
The next part of the prehistory is the review of systems. Review of systems is a mind-body, head-to-toe checklist. 11 systems include constitutional, eyes, ears, nose, mouth, throat, cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, integumentary, neurologic, endocrine, psychiatric, hematologic, lymphatic, and allergy immunologic. In our prehistory, each of these systems is listed with an explanation. Respiratory, for example, asks if there is any trouble with your lungs or trouble breathing.
What if a person does not have a problem with their lungs or problems breathing? What do they write into the respiratory system?
The person can write no problem or no problems breathing.
What if a person has entered shortness of breath as a chief complaint and explained all the details into the history of present illness? What do they write into the respiratory section of the review of systems?
A person could write, I have shortness of breath, as previously described. Sometimes the review of systems questions might cause the person to think of an extra piece of information. For the person with shortness of breath who described the story in the history of present illness, the review of systems respiratory may cause the person to enter if they have a cough or produce any sputum. As a checklist, review of systems is designed to capture extra information while checking the person's body, mind, and spirit.
So the person completes the chief complaint, which is a short statement of why they are seeking medical care. Then they complete the history of present illness, which has a list of questions and allows the person to tell their experience with a chronic condition and status. Then they complete the review of systems, which is a mind, body, head-to-toe checklist. What is next?
The next history or prehistory component is past family social history. This literally includes someone's past history, as well as family history, as well as social history. Past history includes the medication and allergy list. It also includes past surgeries and medical problems. Family history includes information about immediate family members. This could include the medical conditions of relatives, their current age, or age of death. Social history includes marital status, employment status, whether the person uses tobacco products, is exposed to secondhand smoke, consumes alcohol, or uses illicit drugs.
Thank you. Past family social history tells the past history, family history, and social history. Let me draw attention to the medication list in the past history. How should someone list their medications?
The best way to record your medications is to look at the prescription bottle and enter the name of the medication. Metformin, for example, is commonly used for the care of diabetes mellitus. The person can enter the name of the medication, the dose of the medication, how many times a day the medication is taken, how the medication is taken, such as by mouth, and why the medication is taken. It could look like this. Metformin, 500 milligrams, 1 tablet, 3 times a day, by mouth, for diabetes. If the person wanted to take their medication list to the highest level, they could also include who writes the prescription and where they refill their medication. It could look like this. Metformin, 500 milligrams, 1 tablet, 3 times a day, by mouth, for diabetes, from Dr. Michael Warner, CVS, San Francisco, California.
That tells exactly what the person is taking, why, and from whom. Can you give me a clinical example of why this type of detail would be important in a medical record?
Yes, let's consider the medication metoprolol. This is generally viewed as a blood pressure medication, but it can also be used to control heart palpitations. If a medical provider saw a patient with controlled hypertension and multiple blood pressure medications, the provider might consider stopping metoprolol because it is unnecessary. That won't happen if the medication list reads metoprolol 10 milligrams 3 times a day by mouth for heart palpitations.
Thank you. We have a special guest with us today, Lauren Deluca. Lauren is the president and founder of the Chronic Illness Advocacy and Awareness Group. Lauren, why is it important for a person to explain their experience with a chronic disease and submit their narrative to be a part of their health record and represent the history in their health record?
Representing yourself and your experience with chronic disease or condition is all about communication. I live with a chronic disease and have experienced medical care where I have been heard and understood. I've also experienced bad outcomes and mistakes when I have not been understood. Everything you're teaching within this community outreach message was once in the domain of only doctors and medical staff members. And just as we want the patient's medication list to match the health record, we also want the health record to match the patient's experience with the chronic condition. I support new policies and see hope that these policies will be widely accepted, that the medical providers will be better able to understand what their patients are experiencing. I believe by hearing and understanding patients' needs and concerns, we will see improvements in healthcare delivery and the strengthening of the patient-provider relationship. I encourage everybody with a chronic disease or condition to prepare for your next medical visit, complete your prehistory, tell your story, and have your words populate your own health record.
Excellent. Lauren, can you give any specific advice for someone who will try to represent their chronic condition for the first time?
Sure. As we've said before, communication really is the key. And I think the information given in this community outreach message is a really great resource to use. This message shows a meticulous approach to answering a long list of questions, prehistory questions. Let's say you experience pain that wakes you from the middle of the night. I learned in this video that you could represent that in your history of present illness under the element of timing, like what time of day. I also learned I could express this problem in the history of your present illness subset under the status of chronic condition or disease. My suggestion is to just simply give it a try. If you try to represent yourself and you run into some trouble, you can ask a family member to help, or a caregiver, or a friend. And remember, you don't need to complete your prehistory all in one sitting. Work on it, take a break, come back to it later. Really, your prehistory is something that grows and changes over time with you. And I believe that over time, you will learn how to represent yourself and become more of an effective patient advocate in your own care.
Thank you, Lauren, for that powerful message. Dr. Susan St. Pierre is an assistant professor in the primary care department at Touro. Dr. St. Pierre, what do you think about new health record policy changes that encourage patients to tell their story of living with a chronic condition or disease?
I agree with Lauren that the patient-provider relationship is all about communication. I see new policies that give our patients the opportunity to express their narrative as being meaningful, very meaningful. Community outreach messages such as this one will help spread awareness of how patients can play a more active role in their healthcare. As a physician, I know that I can better meet the needs of my patients if I'm able to better understand those needs, concerns, and experiences with a health condition or a disease. I am hopeful that new policies that allow patients to more fully engage with their care will result in better healthcare.
I thank all of our panel members, and I thank all of you for viewing this episode of the Patient Advocacy Show. I hope this episode helps you represent yourself when you seek medical care. We hope our message will empower you to be your own patient advocate and represent your chronic condition in your health record. This community outreach message also includes an IRB-approved survey, which can be found in the description area of this YouTube video. I encourage you to participate in the survey. Our team will track responses and report results back to you in the future episodes. Thank you for viewing, and we'll see you at the next Patient Advocacy Show.